My name is Emily Kiddie. I'm a workforce program manager in the Health and Care Careers Academy, and I'm going to talk to you today about the careers available in health and care and some of the pathways into these careers. I'm going to start by explaining what the Academy is. The Academy is a collaboration of health, care, and education partners working together to create a centralised, systemic, and sustainable approach to developing the skills, values, and behaviours to create work-ready people in Kent and Medway. On this page, you can see some of our partners across the county. We work with all of the major health providers, such as GP practices and hospitals, as well as the local councils who provide social care services and the local schools, colleges, and universities. The Academy will shortly be launching a website which will provide everything you need to know about health and care careers in Kent and Medway, including career pathways, career opportunities, our partners, and lots more information, advice, and guidance. So where can you work in Kent and Medway? It doesn't matter where you live, there will always be a health or care organisation near you. Kent and Medway is made up of 4 health and care partnerships. These are Dartford, Gresham and Swanley, Medway and Swale, West Kent and East Kent. A health and care partnership is a collaboration of system partners across primary care, secondary care, community and tertiary care, the care sector and private sectors to deliver joined up health and care to the community in their area. So what kind of roles are there in the NHS? To understand this, we are going to look at the different sectors of the NHS. Primary care and primary care networks are made up of your GP practices, pharmacy, dental services, and optometry or eye health services. There are 41 primary care networks in Kent and Medway, made up of a total of 192 GP practices. Secondary care is planned or elective care that usually takes place in a hospital. There are 7 leading health trusts in Kent and Medway. These are Dartford and Gravesham, East Kent Hospitals, Kent Community Health, KMPT, which is the Mental Health Trust, Maidstone and Tunbridge Wells, Medway Hospital, and Medway Community Hospital. You can find out about apprenticeship and volunteering opportunities in these trusts by going directly to their websites. Community health services cover a wide range of services and provide care from people from birth to the end of their life, usually in people's homes, including care homes. You may have had a health visitor come to your home after the birth of a child, or had a district nurse come to support an elderly relative. This is a good choice if you prefer to be out and about, meeting people and supporting your local community. The care sector is separate to the NHS, but it is a very important part of the health and care pathway. In Kent and Medway, social care is managed through the 2 councils, Kent County Council and Medway Council. There are hundreds of jobs available in social care across many areas, with care workers being only one of these. To find out more about the different roles available in the care sector, you can visit the Skills for Care page. A little quiz for you now. How many different careers do you think there are in the NHS alone? 50? 100? 200? 300? The answer may surprise you. The NHS is made up of over 350 different jobs and is the largest employer in the UK, with over 1.27 million full-time staff members. There are roles available in the allied health professions, such as physiotherapy, speech and language therapy, operating department practitioners and occupational therapists, or there's nursing, midwifery and mental health. If you're seeking a non-clinical role, there's a vast range of administrative jobs, such as receptionist, medical secretary and human resources officers. And if you prefer hands-on work, we also have a vast estates and facilities team, as well as porters, chefs, drivers, painters and decorators. There are lots of benefits to working in health and care, such as access to occupational health support, annual leave and sick leave, maternity leave, appraisals, and even flexible working opportunities if this is appropriate to the role. You can visit the Health Careers page to find out more about all of the different roles available, and even take a quiz to find out which of these would suit you. So how do you get into a role in health and care? It doesn't matter if you don't have a degree or A levels. All that matters is that you develop the right skills, knowledge, behaviours, and values. And how do you do that? There are multiple pathways into the roles in health and care. Some of these are work experience, T levels, volunteering, employability programs, and apprenticeships. We'll find out a little more about some of these later. Here you can see a small example of how some of these things might be included to develop a pathway into skilled employment, a higher level apprenticeship, or higher education, dependent on your personal goals. You might undertake a volunteering placement, which will help you understand the environment and what sort of role you're interested in. From there, you can undertake a level 2 or 3 apprenticeship, where you can gain a qualification, develop maths and English skills, as well as learn about the job you're doing, as well as getting paid while you do it. From there, you could enter directly into a permanent role, further education, or even a higher level apprenticeship, such as a nursing associate or business administrator. If you decide on an apprenticeship, this will take 1 to 5 years to complete. Anyone can do them over the age of 16, and you will split your time between a training centre or college and getting real practical experience on work placements. You will also have the opportunity to gain qualifications in English and maths if you do not already have these, and upon completion of your apprenticeship, you'll gain a competence qualification relevant to the level of apprenticeship you take. Some apprenticeships in health and care will have a guaranteed permanent role at the end of it as well. One of the best things about apprenticeships is that you get paid while you do them. If you are over 19, you will receive at the very least the minimum apprentice wage for the first year. After this, you will be paid the minimum wage for your age, although many health and care providers pay more than this. You can go to an employer website directly to find out more about their apprenticeship opportunities. There are different levels of apprenticeships. Level 2 is equivalent to GCSEs, Level 3 equivalent to A levels or a T level, Levels 4 and 5 equivalent to a foundation degree and above, and Levels 6 and 7 equivalent to a full bachelor's or master's degree. Entry requirements will depend on the employer and the type and level of apprenticeship. Volunteering is a valuable way to help to learn to develop the skills, knowledge, and behaviours to work in health and care, as well as experience a health and care environment and discover all of the roles and opportunities available while you think about what you might like to do. There is also the opportunity to gain an NVC or National Volunteering Certificate, which may support you to be successful in an application for a job. Volunteering is not only valuable to you, but it enriches the life of the patients you encounter and their family members, as well as supporting the existing workforce with everyday tasks. I hope by now you understand a little more about all of the roles available in health and care and how you might find a career that suits you. There are many resources available online to find out more about health and care careers, and your local job tech centre can support you with this also. Here are links to just some of the further resources where you can find out more, or do a careers quiz to find out which role might suit you. If you have any questions for the Academy, you are welcome to email us at kmicb.kmacademy@nhs.net. The Academy website will be formally launched later this summer. Thank you very much for your time, and I wish you the very best on your career journey.